Welcome to the video pre-brief for your medication administration practice simulation. The goal of this simulation is to practice demonstrating medication administration competency. Please review the objectives and expected actions as listed in the medication administration competency form. You will work in pairs to practice medication administration. A total time of 30 minutes will include patient care time, medication knowledge review time, and brief feedback from your instructor. Details have been provided in your medication administration guide. After you complete the simulation, you will return to the skills lab to complete the documentation portion. There will be a group debriefing after the simulation is completed by everyone in your clinical group. Please avoid discussing the patient with other students until the instructor joins you for the debriefing. You will use a paper MAR and orders located in the patient chart that is provided at the bedside. A simulated patient or SP will play the role of the patient today. Medications will be pulled from the medication carts and scanned prior to administration. Your instructor will assist you as needed with the dispensing and scanning system. One student will be the primary nurse and the other will be the secondary nurse. Your instructor will assign the roles. The primary nurse leads the team, coordinates tasks, and takes the highest level of responsibility for assuring all required tasks are completed properly. The secondary nurse supports the primary nurse by assisting where asked and providing input to assure patient safety. They also inform the primary nurse if they notice something is not safe or not proceeding according to the plan. Your clinical instructor will serve as your charge nurse today should you need assistance. The charge nurse is a resource if you have questions or need guidance. Your instructor will not interrupt you during your time with the patient. They will observe while in the room. Remember that simulation is a learning strategy to help you practice your skills in clinical judgment in a safe environment. Perfection is not the expectation. Mistakes may happen. We are here to learn from the mistakes we will make so we can avoid them in the future. Activities during simulation and skills practice are considered confidential. We want everyone to feel comfortable participating. Please do not discuss the details of what other participants say or do outside of this activity. The Smart Hospital has video cameras in each patient care room. The Smart Hospital faculty and staff use video to monitor labs for technical support and quality improvement. We have done our best to help you experience caring for a patient as you might in the hospital, but we realize that Smart Hospital rooms and equipment might not reflect real life perfectly. You will get the most out of this learning experience if you work with us to suspend disbelief and imagine yourself as the primary nurse caring for the patient in front of you. Please respect and treat each simulated patient as if they are a real patient. Please protect patient privacy and do not discuss the activity with anyone except your instructors. After all 3 safety checks have been completed, any medications to be administered should be handed to your patient. They will accept the medication from you and place it in a bag to be collected by the staff later. For safety reasons, they will not actually consume any of the simulated medications. During the scenarios, if you decide you need assessment data, please describe what you are doing and the patient may provide more detail. For example, you might say, "May I check your blood pressure?" and the patient will provide the numeric blood pressure. If needed, you can assess the patient's chest and abdomen under their gown. Please ask the patient's permission before touching them, just as you do for a real patient in your care. You may also need to ask the patient to lift the breast if your assessment includes cardiac auscultation. This is a practice round, not a test. It is known as a formative simulation designed to help you learn how to improve your skill and accuracy in medication administration. Use this practice round as an opportunity to make a clearer plan for better patient care in your future experiences. This concludes your video pre-brief. You will now receive a report on your patient. The time is now 8:30 in the morning. You are receiving a handoff report to assume responsibility for this patient's care. Patient Chris Shapiro came to the emergency room yesterday evening. The patient was not able to void for more than 12 hours. They complained of pain and pressure to their lower abdomen. Chris stated they had tried to go to the restroom several times throughout the day with no luck. The patient's spouse reports that they have had these symptoms intermittently for almost 6 months, but never wanted to see a doctor. After calling the primary care physician, they were told to go to the hospital. In the emergency department last night, a bladder scan was performed per the doctor's order, revealing over 800 cc's of urine in the bladder. A new 14 French indwelling urinary catheter was ordered by the provider and inserted by the RN at 17:30 with some difficulty. Over 850 cc's of amber, cloudy with sediment and malodorous urine was drained immediately after placement, and a urine specimen was sent to the laboratory for analysis. At 1800, the patient was medicated with acetaminophen 650 milligrams PO for 4 out of 10 pain in the lower abdomen and an elevated temperature of 101.4. Then, at 5:45 a.m., another 525 cc's of amber, cloudy colored urine was emptied from the Foley catheter. Have a great shift!